Man, have you ever just sat down and tried to make sense of why healthcare is so ridiculously expensive in America? Like, it honestly feels like a scam sometimes. And not in the conspiracy kind of way, but in the kind of, how is this even allowed kind of way. You go in for a checkup, or God forbid, an emergency room visit, and suddenly looking at a bill the size of a used car loan. And the worst part, half the time, you're not even sure what you're paying for. The cost of healthcare has ballooned in the past 20 to 30 years. And it wouldn't be so bad if our healthcare was the best in the world, like some people claim. But nope, not even close. Now, as an American, I do think our healthcare is better than a decent amount of places, but we're not leading in outcomes. We're not even close to the top. In fact, I'm pretty sure in a few ways, we're actually doing way worse in some aspects. We have higher rates of chronic illness, lower life expectancy, and more preventable deaths than a lot of other developed nations. So where's all this money going? I think a big chunk of the problem is that a large part of our healthcare money doesn't actually go to healthcare. A lot of it, and I mean a lot of it, goes to administration. Not doctors, not nurses, not even medicine. Just a bunch of middlemen and insurance companies. In other countries, the system is a bit more streamlined. You go to a doctor, they treat you, and that's basically it. Simple, right? Here in America, you go to the doctor and get slapped with 14 different bills from different people that randomly show up whenever it's convenient. It's like playing financial roulette every time you need a checkup. And let's be honest, here in America, healthcare isn't just a service. It's a business. We've got insurance companies, hospital systems, pharmaceutical companies, all with profit motives baked in. There is little regulation on pricing, so providers can just slap on a wild number on anything. Like Tylenol could be $12 or $5K for an ambulance ride. Even if you have insurance, which by the way, you're probably paying hundreds a month for, you're still not in the clear. You got deductibles, co-insurance, or just out-of-pocket fees, all conveniently tacked on for your benefit. You could be paying $500 a month in premiums and still end up paying thousands of dollars before your insurance even kicks in to help. It's like buying a car and then being told the wheels cost extra. Oh yeah, the brakes and the power steering aren't included. Those things are out of network. Basically, the doctor or whoever you're seeing has a contract with your health insurance company or hospital, and that's considered in-network. You can go to a hospital that's in-network, but then say the anesthesiologist or radiologist or whatever. Then boom, you're hit with an unexpected bill. And the fun part is, most of the time, they don't even tell you until they're asking for a payment. How are you supposed to know that? Are you supposed to just stop mid-surgery and check everyone's credentials? Hey, whoa, wait a minute. Before you cut my kidney out and do a bunch of other crazy stuff, are you a network? Just making sure. Yeah. Oh, and there's also a bunch of denial claims. In 2023 alone, 13 to 14% of all claims were denied. That's around 50 million claims. 50 million people being told, yeah, we're not going to pay for that thing your doctor told you that you definitely need, even though we're not a doctor. As someone who's not a doctor, we just don't think it's medically necessary. I want you to think about how crazy that sounds for a second. Sometimes it feels like the system was designed this way, to trip people up and water them down. And honestly, I think it's working. So many people are just giving up. They get a bill, they call the insurance company, then they get transferred 12 different times, and eventually they just pay it. Or worse, they don't, and get stuck with a huge debt for the rest of their lives. Or they don't even go to the hospital because they're afraid of what it'll cost. And that's probably the most heartbreaking part of it. Even insured people are avoiding going to the doctor. They're afraid it'll bankrupt them. They put up procedures, skip medications, they just ignore the symptoms. Not because they're careless, but because the price tag is just too high. So yeah, when people say the system is broken or that health insurance is a scam, they're not really exaggerating. We spend more than anyone else in the world on healthcare, and somehow it feels like we get less. But what do you guys think? Let me know in the comments down below. Thanks for watching. I'm out.